So today we're here for a serious business. We're the one that did this work, and we're expected to what? To really look at it critically before somebody come and start throwing question tomorrow. I don't have what to tell him.
As we go on, you also hear from the facilitators what the expectations are. We'll bring all our expectations together and then come up with a great solution, which will have a good success story at the end.
In order not to leave our board members behind, they have been engaged in blended training for leadership and governance in health, commodity, and humanitarian supply chain leadership.
I'm sure from human resource they heard capacity gap. So when we discovered that there was capacity gap, there was the supply chain management training for all the supply chain transformation team members so that we'll be able to know how to carry on our duties well.
Good morning all. My name is Pam Steele, CEO for Pamela Steele Associates, based in Oxford. And we've been working with the team here, so thank you.
It is a time to check and see that we solve that problem or we recalibrate. We are having information from both quantitative and qualitative data. So we can't do away with qualitative. We can't do away with the issues of challenges, as was mentioned. We can't do away with the issues of context. We can't do away with the issues, for example, of human resource to be able to undertake the project.
I want to assure you that on our part as Global Supply Chain, we are fully in support of this project.
So the pilot has tested third-party logistics, where facilities get their products delivered to their doorsteps.
So we came in and we designed a system that is innovative, that you can on a fly dispense a product and it's automatically uploaded into the server, date stamped and timed with the full description of the patient. So anywhere online, even by text message, you can request a particular prescription and will bring back the data of the patient with the date it was done, the gender of the patient, the kind of prescription that was given to that patient.
Emphasis was made for stakeholders to continue to work together with renewed commitment.
The introduction of the SMS, data collection quality, really improved. There was improvement in quality of even the data.
This initiative, I'm sure, is something that is completely new to Kaduna State.
I have my colleague with me here. We are from the USAID Global Health Supply Chain Project. Public health supply chain transformation is, to me, a well-designed project.
It is indeed our pleasure to be part of this process. HSDF is totally in support of the transformation project, and we're honored to be here to see the good work which has gone on. And we know that in the next phase, which will involve scale-up, we strongly will work with all stakeholders to ensure that the outputs and the essential deliverables of this project will end up at the beneficiary's desk.
We've been very excited to see the DMA leadership take charge, and where we can, we provide some support, but really from behind. And it's a great example of learning by doing. And if we can get the systems issues right, we can go a long way to making change. And they're very interested to see what is going to stick in Kaduna and what will Kaduna State buy into. So there's a lot of interest from our senior leadership, Kaduna State, to move this forward.
The need for a good quality and standardized data it's important in any effective supply chain system. The need to go to the facility should be based on exception. It should be when the need arises. So we need to work together as a team to make sure we feed the system with good quality data.
We started harvesting the manual data from the prescriptions at the facility before this SMS was deployed. But this data you are looking at is the one that everybody in this room has been sending using their SMS.
You can't just send anything they want to the system because the structure has already been established.
We had lack of proper arrangement and traceability of commodities. Sometimes it takes the store officers ages to trace a particular product because of how the warehouse was arranged. Product availability has increased. Remember the last time I said was less than 30%, but right now it's about 70%. It has increased to about 70% product availability.
You will need 149,000 naira to get that product. But for the pilot, you will need 33.75 naira.
Most staff leave their facilities to the DMA and stay for close to 3 days before their requisitions are met, but that has been completely eliminated.
Governing Board of the Kaduna State Drugs and Medical Supplies Management Agency was inaugurated by the Governor of Kaduna State with the mandate to support the leadership of the agency towards improving and sustaining efficient service delivery to the people of the state. The primary objective of the governing board of this agency is also to ensure the optimal functionability and efficiency in terms of service delivery to the people of Kaduna State. Pamela Steel Associates Limited, as a technical partner to the Bill and Melinda Gates Foundation, has designed a 6-month blended supply chain executive leadership and governance training.
But with this program now, all you need to do is to send your requisition, then your products are delivered at your doorstep.
And the greatest joy I'm having is that they bring the drugs to my facility. I so much enjoy sending the text. At least it's easier for us, it's easier for them.
For delivery of drugs, time wastage has really decreased.
There is increase of knowledge.
I am particularly happy that this is happening within my backyard. The unintended effect, I don't know whether this program was designed to actually sanitize our prescription pattern, but really it has done a lot on that. And honestly, before, even somebody in the lab, they would just do tests, bring out their usual prescription sheet and prescribe. We all know it, they do it. But now you can't do that in the facilities. And if there's anything that has made this program laudable and very acceptable, is the sanity that the coded prescription sheets have brought.
No, thank you for all of these commentaries and these testimonials. I like that you're talking not just about the achievements, but about the challenges. So that's the way we can try to improve.
So what we have been doing in the last 1 year is what we call a trial run. Scaling up, as we said yesterday, refers to deliberate efforts.
And that's why it's very important to do a lot of transformation work with the local governments. Tomorrow, we want to see that local governments can repair the road leading to your house. The desire of His Excellency is that what local governments are supposed to be doing, he wants them to be doing them very well. You will enjoy more recognition than ever before. In our budget for 2018, there is more than 2.5 billion for medicines and commodities for PHCs.
We are on a super group. Yes. What it means is that all the health workers in Kaduna State can join this group, even if you are not on the pilots.
On one of the sheets, what do you long for? That is number one. Number two is what is lacking. Number three, what did you learn? Then the fourth one is what did you like?
For me, it marked, a milestone.
But with this program now, all we need to do is just send our request and the product will be delivered at our doorstep. In fact, at times some of my staff will come and ask me, "Sir, are you sure the price of this product is correct?" Because some of the prices are cheap compared to the prices we were selling before. I want the program to continue in my facility.